Dr. Alexander Diddick. I'm the director of pain medicine at HealthU Clinics. I'm going to take some time to talk to you about targeted drug delivery. This webinar is about intrathecal pumps for chronic pain. Once again, my name is Dr. Alexander Diddick. I'm a pain medicine specialist. I see patients across the valley for HealthU Clinics in the West Valley, East Valley, and North Phoenix. I'm born and raised in Phoenix, Arizona. I did my family medicine residency program here at Abrazo Central. And then I did 2 pain medicine fellowships, followed by a sports medicine fellowship. Wonderful to be here tonight and talk to you about it. I have no disclosures for this webinar. Our agenda is to talk about targeted drug delivery, as well as to determine who's a suitable candidate for this treatment, as well as discuss the risks and benefits of a pain pump, and then have a brief overview of the postoperative course following an implant of a pain pump. So what is a pain pump? So a pain pump is also known as an intrathecal pump. This is a way of relieving long-term kind of chronic pain, as well as these can be used for patients with chronic spasms and spasticity. What we do with a pain pump is we send pain medicine through a thin, flexible tube. We call this a catheter. This tube is inserted into the area around the spinal cord. We call this the intrathecal space. And that tube is connected to a round pump. Both are going to be implanted underneath someone's skin. This is a minor surgery that we perform, but it also can be a permanent solution for pain. The medication that goes in the pump is filled every 3 months, and that medication is constantly flowing, as well as giving pain relief. So the area between your spinal cord and the tissue on the outside of your skin is called the intrathecal space. This is where the image on the right, we can see a look of the spine as well as the spinal cord and the space where nerves live. The fluid that bathes the nerves in your spine is called cerebral spinal fluid, or CSF. The space where the nerves float, and then CSF is called the intrathecal space. So this space is where we place the catheter, and what goes directly in that space is pain medicine. Very strong pain medicines such as morphine. The upside of this is the doses that are needed are very, very low in comparison to oral pain medicine. When we take any kind of pain medicine, like an opiate, which has a lot of side effects and sometimes can be a lot challenging for patients to take, most of that medication is processed by our body, meaning we use very, very little of it. Most of it's either processed by our liver or kidneys, and we use a small percentage of it. If we place medication directly at the injured nerves or the area of someone's pain, what we could use is a fraction of the dose that we would need for oral medications. And so what this allows is less medication, less side effects, and much, much better pain relief. I'm going to show you a video about introducing you to target drug delivery, because sometimes a picture is worth 1,000 words. We'll take a look at this video and then we'll rejoin afterwards.
See important safety information at the end of the video. Only your doctor can determine if this therapy is right for you. Think about it. You don't need an axe to crack a nut. You don't use a blowtorch to light a candle. And constant pain shouldn't be treated with piles of pills. Most people take pills for pain, and it takes a lot of pills when you're in a lot of pain. Pills must travel through the stomach and intestines. Then the medicine travels through the bloodstream before finally arriving at the site where it works. Oh, the side effects of all that medicine. It often takes more pills to treat these. And the stigma around taking all of those drugs is scary. Well, engineers at Medtronic invented a smarter way to control chronic pain. It's called targeted drug delivery, and it has been available for some time. A pump is implanted just under the skin. Tiny doses of pain medicine travel from the pump through a thin, flexible tube to the fluid surrounding the spinal cord. The right amount of medicine goes to the precise spot it's needed to most effectively treat the pain. Voila! Targeted drug delivery gives you pain relief with a fraction of the amount of medicine. And because there's no longer a giant amount of medicine floating through the body, targeted drug delivery has fewer side effects compared to taking many pain pills. More good news. Many patients using targeted drug delivery no longer need any pain pills or need much less. Ask your doctor about a targeted drug delivery trial to see if this pain therapy is right for you. It's like taking a test drive before deciding. If you decide to move forward after the trial, you'll get scheduled to implant your pump, which is usually an outpatient procedure that takes about an hour. Once you have your pump, here's how it works. Your doctor programs the SynchoMed 2 pump to deliver the exact amount of medicine you need. The pump is typically refilled every few months. This means fewer doctor appointments to request drug refills and fewer trips to the pharmacy. More time for you to do the things you enjoy. Discover more about Medtronic targeted drug delivery at medtronic.com/painpump. Get ready to say goodbye to piles of pills and miserable side effects, and hello to doing more things you love. Important safety information. The SynchoMed 2 infusion system delivers pain medication directly to the fluid around the spinal cord for the long-term treatment of chronic pain, such as cancer pain, back or leg pain, complex regional pain syndrome, and painful neuropathy. Targeted drug delivery should be considered after you have tried oral medications or other therapies and they have not worked or you cannot tolerate them. Pump or catheter problems can occur after implantation, which may require corrective surgery and/or cause a drug overdose or underdose that may be serious or life-threatening. Implanting the system has risks similar to any surgical procedure, including infection. Drugs infused through the system may result in adverse effects. Errors in locating the pump during the refill procedure can result in symptoms of overdose that may be serious or life-threatening. Not everyone responds to targeted drug delivery in the same way, and your experience may vary. To understand the benefits and risks of targeted drug delivery, please discuss them in detail with your physician. A prescription is required. For complete safety information about Medtronic targeted drug delivery therapy, call Medtronic at 800-328-0810 or visit Medtronic's website.
Pumps are very, very effective. I really don't have many patients or any patients who are unhappy with having a pump. And the reason why that is it's very easy to change the dose of the medication as well as change the concentration of the medication. We're going to go through this in a slide or two about how specifically the medications work, but imagine if it was much easier to kind of change or get your pain under control because it was as easy as pressing a button. When I was in residency, I created this poster about intrathecal pumps in the management of non-cancer pain. And the takeaway was, wow, it's amazing to me to see that patients who go through the process of getting a pain pump, how much improvement they see, where there is a significant reduction in the amount of opiates that people take. Looking at the outcomes of this, patients used to be on 189 milligrams of equivalents of opiates. And then after 3 months, this could be decreased all the way down to 3.8 milligrams on average of weaning patients off. I've known multiple providers who are able to completely wean their patients off of oral opiates regardless of the dose. And I think that's kind of an incredible feat given how challenging that can be. So how does this work? Again, we're trying to limit systemic opiates. We're trying to reduce the amount of medication someone's taking orally, because the less medication someone's taking prior to implant of the pain pump, the better. It requires even less medication to go through the pump. Part of this is there's a workflow and how this ends up working. The biggest challenge when it comes to a pain pump is there are steps that go into getting this authorized by the insurance. What we're looking at is ultimately psychological clearance is one of the first steps we do. We do another step called a pain pump trial, which we'll go over again in another slide. Then we pick a surgical date once the implant is approved and About 60 to 90 days before that surgical date, we start weaning oral opiates significantly down. This helps with postoperative pain, but it also really significantly increases the effectiveness of the pump long term. So, how do we find patients? Are you an eligible patient for a pain pump? Now, anyone who's been on chronic high dose opiates or even low dose opiates and is not looking to go up any further on those medications, or someone who's been on stronger pain medications and was intolerable because they had side effects, maybe constipation or dizziness, lightheadedness, respiratory issues, or just not feeling well while on those medications, can be an excellent candidate for pump. So are people who are elderly and opiate naive who aren't looking to be on oral opiates. We also have many patients who, let's say, have had back surgery before or have other kind of chronic pain syndromes that may benefit, including neuropathy or numbness and tingling in their feet that can benefit from a pain pump. So there is multiple different indications for a pain pump, and they are extremely effective. I was talking to a patient earlier this week about this is not a last line treatment. This is a very effective treatment for people. It's that we have to get to a point where we're willing to have a device implanted underneath our skin and have medication that's kind of administered directly into the spine. It's an area of pain, but they are extremely effective and they are very low risk ultimately. So we talk a little bit about doing a pain pump trial before implantation. Before having an intrathecal pain pump implanted, we have a test that we do in the office. This test is I administer a bolus or just one single dose of pain medicine directly into the spine, into that intrathecal space. We do this as an outpatient procedure in one of our procedure sites. If any patients had an epidural before, it's similar to that sort of procedure where we're putting medicine directly into the area where the nerves are. And then we have the patient kind of sit for about 30 to 60 minutes after the procedure, and we see how they did. And almost every patient we have who does a trial does very, very well with this because, again, there's not any mystery to this. All we're really doing is putting pain medicine directly into the area of someone's pain. Intrathecal pain pumps are a surgical procedure that we do outpatient. This is often done under conscious sedation, which can be done with propofol, similar to what someone gets for a colonoscopy, but also can be done under general anesthesia. Implant takes somewhere between 45 minutes to 60 minutes for a complete implant from start time to finish. And it's done with two small incisions, one incision for the catheter and the second incision to be able to implant the pump underneath the skin. Most vast majority of cases of pain pumps have no complications. The biggest complications or side effects or challenges that come with pumps is just post-operative management related to the pump. Catheters can sometimes malfunction. The pump can have sometimes challenges in terms of programming, but mostly we have great outcomes from this. Very low risk for any kind of post-operative infection or bleeding, almost non-existent side effects to the medications because the doses are so small. A catheter does not have any kind of sharp edges or anything. People ask me if I put that into the area of the nerve, can that cause nerve damage? Theoretically, but I've never seen it. Ultimately, if we're putting medication directly into the area of the spine, I do not see really significant side effects in terms of how that medication affects the nerves. There could be a need for more medication over time, but again, that's another benefit over oral opiates as well, at so much lesser extent compared to oral medications. So overwhelmingly, this is a positive. The risk of any time we cut someone's skin, there can be a small risk of bleeding or infection or need or pain at the local site, but ultimately, we do everything we can to minimize those risks and do things as a standard of care. And overwhelmingly, for patients, the benefits far outweigh the risks. So what do we expect if we go towards a surgical implant for a pain pump? So postoperative pain is generally incisional pain. Incisional pain is anytime someone who's had surgery before or has had, maybe they cut themselves and needed stitches. We're talking about pain local at the area of where the incisions are because that tissue needs to heal. And that's usually in that first week is most of the pain that people will experience, sometimes only for a few days, but at least a week is what I tell most patients. For about 6 to 8 weeks over after surgery, your skin will continue to heal. After about 2 weeks, we're generally removing any kind of sutures or staples that are underneath the skin, but we're trying to take it easy, trying not to lift too much. As that pain pump is starting to become part of you. That's the easiest way to kind of describe it. So we're trying to limit our excess bending, lifting, and twisting. We're trying to take it a little bit easy until our tolerance of those activities increases. And usually within a few weeks, that starts really picking up. After implantation, we follow up to generally one or two post-operative visits in the first week and the second week to see how things are going. Generally, by again 2 weeks out, we are doing either suture removal, staple removal, and it looks good. And at the time, once the wound is healed and everything looks good, the pump is programmed and filled at that visit. And so, within about 10 days after implant, we fill the pump with medication, and it's flowing and providing pain relief on that day. So how is this program? Since this is underneath your skin, we have a device that's able to scan the pump. That's able to read over the skin as well. And we program this basically with a tablet. And that tablet allows us to change the settings. It allows us to change the frequency of the medication. And then we end up printing a report for our patients every time we make any kind of change or fill the medication. How often is this pump filled or the dose is changed? We generally are looking for doing a fill every 3 months. That's kind of the standard. It can be done sooner. We can do refills on a more frequent. Generally, that's not needed. Generally, after a pump is implanted, we do multiple different dose adjustments. So we go slow and increase that dose, maybe at 1 or 2 week intervals, where we're increasing the dose of the medication to find what provides the best pain relief for our patients. So to give a little bit of understanding of how this pump works, I wanted to add this image on the right showing what the difference between a bolus is and a basal rate is. So a continuous infusion is also known as a basal rate, meaning medication is always flowing, where there's always medication that's being flowed from the pump into the catheter, into the intrathecal space, providing pain relief. But we also have something called bolus dosing that we are able to program, which gives our patients a receiver or basically something that kind of looks like a device that you can press a button to allow themselves to get extra medication. So, for example, if I allowed 2 or 3 boluses a day for patients, they would get an extra dose of medication. And then, let's say 4 or 6 hours later, they would get a second dose of medication if they press that button again, and maybe a third dose of medication later. So, it effectively also kind of mimics what people get from oral medication, meaning I get to decide when I need to take extra medication too. So, you can both have a continuous infusion going, which is the standard, as well as also program it to have bolus dosing as well. Flex dosing, it's either programming for bolus dosing or flex dosing. But let's say someone had really significant pain right when they wake up in the morning. You could program the device to give extra medication about 30 minutes before someone's normal time of waking up, so that they have additional pain relief before they at the time of when they wake up every day. My TPM is basically that personal therapy manager that's utilized that patients are able to press. That's why on that image on the right, it says deliver bolus. Patient's able to press that button, and then the medications is able to deliver extra medication at that time. How long does the device last? The battery within the pump usually lasts between 4 to 7 years. After about 4 to 7 years, there will be an alert that says the battery is wearing down, and then we do a battery replacement where we make a incision at the pump site and we swap out the old battery for a new battery. Why does HealthU Clinics utilize Medtronic's system? It's because it's the best one. It's been out for about 30 years, and it's the leader when it comes to intrathecal pumps. This is the device that I use, and I've had really, really good results with our patients for them. This is just an image of the pump, kind of showing that they have a new model that's come out on the market that programs a lot easier, and patients have been very happy with it so far. In summary, should you consider an intrathecal pump? Uh, if you have chronic pain and the pain is poorly controlled, someone is a candidate for a pump. Pumps are very effective. They are not a last line treatment. They're also an excellent treatment to help people wean off of oral opiates as well. And if patients have had other surgeries or had other options that did not work for their pain, I strongly consider a pump for my patients. You can contact us at Healthy U Clinics if you'd like to schedule an appointment or would like to find more information out regarding pain pumps or any other pain complaint someone has. We're happy to see you with our valley-wide locations.